Thank you. I'd like to thank SAGES for this opportunity to kind of show what we're doing at UT Southwestern. I don't have any disclosures. I thought, this has been kind of stated before, but I thought it'd be a good review as to understand how we implemented the FEC into our residency program, is to really understand what FEC is and what the American Board of Surgery is trying to achieve in their goals and objectives. So the ABS defines this, a surgical endoscopist is a surgeon who has the knowledge and technical skill to use flexible endoscopy to provide care for patients with common gastrointestinal diseases. This includes an understanding of the indications and contraindications to endoscopy, recognizing and managing normal and abnormal findings, along with the complications that can happen in endoscopy. Safely being able to perform upper and lower scopes, mucosal inspection and recognition of lesions, tissue accusation and biopsy or polypectomy, management of periprocedural bleeding, and placement of PEGs. So the ABS designed the FEC to be completed throughout general surgery residency, and the goal is that it's a stepwise curriculum with both didactic and technical milestones that are to be achieved at each level of residency. And the goal and the push really is to complete this by the end of the PGY 4-year. And I think most recently the ABS sent an email out to the program directors really encouraging that the residents take the FES exam by September of their chief year to achieve this. The ABS also, in their curriculum, identified some resources that they think that each general surgery residency program is required to have to be able to achieve a successful flexible endoscopy curriculum. One of those things is having an expert in flexible endoscopy. This can be a surgical endoscopist, it can be a gastroenterologist, but what the ABS says in their curriculum is that their hope and goal is that this transitions to a surgeon endoscopist over a period of time that's going to be training all the surgical residents. They also encourage a flexible endoscopy simulation with a skills training lab, and this can be achieved in a variety of ways, and the ABS doesn't really go into details about how this should be done. And the other thing that they suggest and really want is a dedicated clinical rotation in flexible endoscopy for all general surgery residents. The FEC, the curriculum, is over 5 levels through residency, each having a cognitive and technical milestone to be completed in a stepwise fashion. The cognitive milestones are based on SCORE curriculum that's already established, and the FES didactic online modules that are free access to everyone. The technical milestones that they want everyone to achieve is training on inanimate trainers with real endoscopes, some sort of computer-based simulator training if possible. The clinical experience that they want all residents to achieve is dedicated endoscopy rotation, intraoperative endoscopy, ICU endoscopy, and then endoscopy as part of a GI surgery service. And then they suggest using the gauges, which we had mentioned before, as a tool of assessing the residents and their progression through the FEC curriculum. And these are the 2 gauges, score sheets, one for upper endoscopy and one for lower endoscopy. And it's been shown that a score of greater than 18 on either one of these is highly correlated with being able to successfully certify and pass the FES exam. They have 5 levels in the FEC curriculum by the ABS. Level 1 is to be finished by the PGY1 to PGY2 level year, and level 2 again in PGY1 in 2 years. And in these 2 levels, it's really didactic and cognitive milestones, and then learning about the endoscopy cart, the endoscope, the setup, and kind of the basics of endoscopy. Level 3 is to be completed in the PGY 2 or 3 year. This requires a dedicated endoscopy rotation, and then the residents having standardized assessment through gauges on upper and lower scopes. And then in level 4 to be completed in the PGY 3 and 4 year, again, gauges with a minimum score of 18 for each resident. And then finally, to be able to attain all their procedural numbers, 50 colonoscopies, 35 EGDs, and then of course the FES certification. I will say that there is a push, though, to achieve and finish this curriculum in a shorter period of time and not to leave it to the PGY 5 year for completion. FES certification is 2 parts, a web-based multiple choice exam assessing cognitive function that's about 80 questions, and then a hands-on virtual reality platform to evaluate the technical and psychomotor skills on GI Mentor, and it evaluates the 5 skills listed below: navigation, loop reduction, retroflexion, mucosal evaluation, and targeting. Again, as mentioned before, this is a new ABS requirement that all surgical residents finishing residency in 2018, so that means the current PGY 4 year, have to complete FEC and achieve FES certification to be board eligible. So what have we done with the FEC at our institution? We designed it to span over 4 years, of course achieving the cognitive milestones using the SCORE modules that have already been outlined and the FES didactic curriculum. And then the technical milestones we achieve with simulation using the GI Mentor for Endobubble, using the STEP program, GI Mentor cases for upper and lower endoscopy, and then a clear clinical experience that's spread throughout PGY 1 through 4 years. This is kind of a snapshot of what our curriculum looks like, and I'll go through each year in just a minute. So Endobubble 1 and 2, these are, I'm just going to go through kind of the different simulations that we have and how we're achieving our skills training. So the Endobubble is on the GI Mentor. Our residents are required to complete Endobubble 1 and 2, which is a simulated hollow viscous with balloons that have to be popped without touching any of the mucosa. And they have goals in order to be able to attain proficiency in Endobubble 1 and 2. And then we have the surgeon's training for endoscopic proficiency, or the STEP program, and we have our residents go through step 1, 2, and 3. Step 1 is the basic introduction to endoscopy, the cart, the endoscope, and the setup. Step 2 is the simulation modules, the Truss, the operation, and Kyoto, and then the step 3 is an explant lab with endoscopic tasks and sills in a pig model. So the first model that the residents work with is the Truss, and this is designed to practice retroflex targeting with the 6 targets. And there's a picture of the model there. You can create this at your institution. It doesn't take a whole lot to put it together and is relatively inexpensive. The endoscopist has to hold and acquire each target for 5 seconds with 4 out of 5 of the points of the star between the 2 concentric circles. And then we have the goal proficiency time to complete all 6 listed there at 274. And then in the right lower hand corner is the a diagram about where all the targets are. In the operation model, this is for oriented targeting. We use the operation game and modify it, and the endoscopist has to touch the metal of each organ with to create a buzz with a biopsy forceps, with some rules of where to achieve that, and then the proficiency times is listed there. And then finally, this is the loop reduction model that the endoscopist practices on for proficiency of loop reduction. And then we also are fortunate enough to have a GI Mentor for our residents, which is a virtual reality simulator. This is what FES is based off of, and our residents are able to practice upper and lower cases. However, to say that the FES cases and skills are unique, and those are not accessible and available. So what is accessible is separate upper and lower cases that can be practiced and trained on. So again, this is our FEC curriculum at UT Southwestern. Like I said, it's spread over 4 years, and I'll go through each one. And the PGY, every categorical PGY1 rotates on our MIS bariatric service. They're required to complete the cognitive portion of SCORE for upper scopes, Endobubble 1 and 2. And then clinically, they perform all our intraoperative EGDs, and they're assessed with gauges in the first week and the last week of their rotation, with the goal of achieving at least 10 upper scopes during that month. In the PGY 2 year, they rotate on day surgery, and during this time, they're expected to complete the cognitive SCORE colonoscopy modules, and to begin step 2 with the simulation modules and GI Mentor. And they pre-test and post-test at the beginning and end of the month on these. And then clinically, we have a gastroenterologist that does upper and lower scopes, and they're able to get their clinical experience and assessment on gauges at the beginning and end of the month with that as well. In the PGY 3 year, they rotate through our colorectal service, and again, during that time, they achieve their cognitive SCORE modules on colonoscopy. Practice more with step 2 in the simulation modules. And then in the 3rd year, we do step 3 with the porcine model to do our skills and tasks. And then their clinical experience is on the colorectal service, and they have assessment with gauges at the beginning and end of their month. And then finally, their flexible endoscopy rotation is currently in the PGY 4 year. I will say next year we're transitioning that to our PGY 3 year in order to better prepare our residents and set them up for passing FES. 1 month prior to their rotation, they are required to do these clinical skills models in the skills lab, the 3 that I listed before, and to self-study on the GI Mentor. Subsequent to that, they start their clinical rotation, and during that month, they again are required to be in the skills lab to do their FES didactic curriculum, achieve their numbers, and at the end of their rotation, to take their FES exam. Last year, we were able to study this curriculum, and our fellow from last year, Dr. Gazzetta, is presenting this at SAGES. The proficiency-based preparation significantly improves FES certification performance. And this was a study that was completed last year. We had 15 residents in their PGY 4 year that had not previously had a clinical rotation on endoscopy. They pre-tested for FES, and we had about a 53% pass rate. And through the year, they completed this FES curriculum that's outlined for the PGY 4 year. And at the end, they took the FES exam as well, and they were able to improve their pass rate to 93% from 53%, which was great for our residents. So what happens if a resident fails FES? So we have a remediation. If the resident fails, they only need to take the portion of the exam that they failed, so that's really important. And then we plan on a one-on-one mentoring on either the didactic, the skills, or if they failed both, with the site director, which is me, and we focus on the area of their deficiency. And they are required to try for their FES certification within 2 months of their GI endoscopy rotation. It's important to remind residents that the rules of the FES is that if they fail, there is a waiting period to be eligible to retest. For their first one, it's 30 days. The second retest is 6 months from their previous state, and the third retest is again 6 months from their previous state. This is really important to consider and encourage residents to take their FES early and not wait until their chief year, because if they do that and they fail, they are at high risk of not being board eligible, which would be a shame. So that's why encouraging completion of this FEC curriculum and FES certification by the end of the 4th year is important. So we also created a catch-up plan in terms of catching up all the residents that were not part of the curriculum, and that's kind of listed here, but I think that's important to any kind of new curriculum that's established to make sure that there aren't residents left behind. And then finally, we created a flexible endoscopy report card. And this report card goes into their online electronic system that we have for evaluation of the residents and follows them as what we're planning on through their entire residency, and a way to kind of keep track of our curriculum and what the residents have completed, where they are, and what they need to do to get to a point before graduation. There are some really good resources. I've listed them there. And then I encourage all of our residents to watch the SAGES webinar series that just came out in September. It kind of goes through the details of FVS, the exam, the tasks, what to do, and how to pass.